Healthy Insurance in the United States Part 1. Health insurance in the United States is any program that helps pay for medical expense, whether through privately purchased insurance, social insurance, or a social welfare program funded by the government. 1. Synonyms for these uses include health coverage, healthcare coverage, and health benefits. In a more technical sense, the term health insurance is used to describe any form of insurance providing protection against the cost of medical service. These uses includes both private insurance programs and social insurance programs such as Medicare, which pools resources and spreads the financial risks associated with major medical expense across the entire population to protect everyone, as well as social welfare programs like Medicaid and the Children's Health Insurance Program, which both provide assistance to people who cannot afford health coverage. In addition to medical expense insurance, health insurance may also refer to insurance covering disability or long-term nursing or custodial care needs. Different health insurance provides different levels of financial protection, and the scope of coverage can vary widely, with more than 40% of insured in very individual reporting that their plans do not adequately meet their needs as of 2007. The share of Americans without health insurance has been cut in half since 2013. Many of the reforms instituted by the Affordable Care Act of 2010 were designed to extend health care coverage to those without it. However, high cost growth continues unabated. National health expenditures are projected to grow 4.7% per person per year from 2016 to National health expenditures are projected to grow 4.7% per year from 2016 to 2015. Public health care spending was 29% of federal mandate spending in 1990 and 35% of in it 2000. It is also projected to be roughly half in 2015. Trends in private coverage: the proportion of non-elderly individuals with employee sponsored cover fell from 16% in 2000 to 56% in 2010. Then established following the passage of this Affordable Care Act, employees who worked part-time were less likely to be offered coverage by their employer than were employees who worked full-time. A major trend in employer sponsored coverage has been increasing premiums and co-payments for medical service and increasing the costs of using out-of-network health providers rather than in-network provider. Trends in public coverage: public insurance cover increased from 2000 to 2010 in part because of an aging population and an economic downturn in the later part of the decade. Funding for medical and CHIP expanded significantly under the 2010 Health Reform Bill. The proportion of individuals coverage by medical increased from 10.5% in 2000 to 4.5% in 2010 and 20% in 2015. The proportion covered by Medicare increasing for 13.5% in 2000 to 15.9% in 2010, then decreased to 14% in 2015. Status of this unisuffered: the unisuffered proportion was stable at 40 to 50% from 1990 to 2008. then rose to a peak of 18% in Q3 2013 to rapidly fall to 11% in 2015. The proportion without insurance has established at 9%. A 2011 study found that there were 2.1 million hospital stays for uninsured patients, accounting for 4.5% of total agreed inpatient hospital cost in the United States. The cost of training the uninsured must often be absorbed by providers as charity care, passed on to the insured via cost shifting and higher health insurance premiums, or paid by taxpayers through higher taxes. Debt. Since people who lack health insurance are unable to obtain timely medical care, they have a 40% higher risk to die in any given year than those with health insurance, according to a study published in the American Journal of Public Health. The study estimates that in 2005 in the United States there were 45,000 deaths associated with lack of health insurance. A 2008 systematic review found consistent evidence that health insurance increased utilization of service and improved health. Uninsured patients shared their experience with the healthcare systems in the United States. A study at Johns Hopkins Hospital found that heart transplant complications occurred most often amongst the uninsured, and that patients who had private death plans fared better than those covered by Medicaid or Medicare. Reform. The Affordable Care Act of 2010 was designed primarily to extend health coverage to those without it by expanding Medicare, creating financial incentives for employers to offer coverage and requiring those without employer or public coverage to process insurance in newly created health insurance exchanges. The requirement of almost all individuals to maintain health insurance is often referred to as an individual mandate. The CBO has estimated that regularly 33 million who would have otherwise been uninsured will receive coverage because of the Act by 2020. Repeal of individual mandate. The Tax Cuts and Jobs Act of 2017 effectively the Tax Cut and Jobs Act of 2017 effectively repealed the individual mandate, meaning the individuals will no longer be penalized for failing to maintain health coverage starting in 2019. The CBO projects that this change will result in 4 million more uninsured by 2019, 13 million more by 2027. Under insurance, main article, health insurance coverage in the United States underinsured. Those who are insured may be underinsured such that they cannot afford full medical care. For example, due to the exclusions of per exiting conditions or from high deductibles or co-payments. In 2019, Gallup found it while only 11% reported being uninsured, 15% of US adults said they or a family member had daily treatment for a serious medical conditions during the year because of cost up from 12% in 2003 and 19% in 2015. For any conditions, 33% reported daily treatment, up from 24% in 2003 and 31% in 2015. Stay with us. The second lesson will be given to you very soon. Thank you.